Hello everybody, hi, I'm Jewel and welcome to my channel. I hope that all of you had a really nice Christmas holiday, that you had everything you could possibly need, that your families are doing well, and all of you are safe. So guys, today I would like to talk about the CDC and their updated guidelines for people with underlying health conditions. Let's get started. What you need to know. The CDC updated its COVID-19 vaccination guidelines for people with underlying health conditions. People with underlying medical conditions may receive a COVID-19 vaccine, according to the CDC, provided they have not had a severe allergic reaction to any of the ingredients in the vaccine. The CDC issued guidelines for people with conditions such as HIV, autoimmune conditions, and Bell's palsy. People who receive COVID-19 vaccines should continue to wear masks and practice proper social distancing, according to the CDC. The CDC noted that mRNA COVID-19 vaccines may be administered to people with underlying medical conditions, those who are at a higher risk of becoming severely ill with the novel coronavirus, provided they have not had a severe allergic reaction to any of the ingredients in the vaccine. The CDC also advises that people who receive COVID-19 vaccines should continue to follow guidelines put in place to stop the spread of the coronavirus, including wearing a mask, avoiding crowds, following recommended social distance guidelines, and practicing proper hand washing. Here is the updated guidance for the CDC. People with weakened immune systems, the CDC advised that people with HIV and weakened immune systems may be at increased risk of severe COVID-19 infections and may receive the COVID-19 vaccine, but safety information for that specific group is not yet available. People living with HIV were included in the clinical trials, the CDC noted, though safety data specific to this group are not yet available at this time. People with autoimmune conditions. The same guidance is true for those with autoimmune conditions. They may receive a COVID-19 vaccine, but no data is currently available on the safety of the mRNA COVID-19 vaccines for them. Individuals with autoimmune conditions were eligible to participate in COVID-19 vaccination trials per the CDC. People who have previously had Guillain-Barré syndromes. To date, no cases of the Guillain-Barré symptoms (GBS) has been reported following vaccination among participants in the mRNA COVID-19 vaccination clinical trials, the CDC noted. According to the National Institutes of Health, GBS is a rare neurological disorder in which the body's immune system mistakenly attacks part of the peripheral nervous system. The CDC notes that people with GBS may receive the COVID-19 vaccination, though experts are still researching. People who have previously had Bell's palsy, while people who received the COVID-19 vaccines in clinical trials reported experiencing Bell's palsy, the FDA does not consider these to be above the rate expected in the general population and have not concluded that the cases were caused by the vaccine. Therefore, people who have previously had Bell's palsy may receive an mRNA COVID-19 vaccine, the CDC said, but experts are still gathering data. So guys, as you see, there are some people with immune systems that have been tested by the CDC, and they said that these people with underlying medical conditions can receive the vaccine because those people were a part of the CDC trial. But as you know, when the CDC had the trials for the vaccine, for COVID-19, kidney patients were not included in this trial. So as of yet, we don't know what's going on with kidney patients. And they said people with immune systems problems can take the vaccine, but the National Kidney Foundation and other kidney communities have not said anything about this right now because apparently they are still waiting for data from the CDC of how people with immune system problems have done with the vaccine. So as of yet, our kidney community CDC patients have not had any information yet about the COVID-19 vaccination and when they will be and when they'll be given to kidney patients. We're just waiting, like other people, to see what's going on. So as of right now, this is all the information that the CDC has posted for people with immune deficient systems about the vaccination, but nothing was said about CKD patients because none of the CKD patients were in trials to find out, how the vaccine has done. So, guys, this is all the information I have. So, if you found this useful in any way, please like, share, and subscribe. And as always, sending you so much love, so much affection, just to let you know that you're not alone in this journey. There are so many of us that are going through the same thing you have gone through. People with that are doing dialysis, people that are in between waiting for transplants, and transplant patients like myself. We're just waiting for our doctors to give us permission to let us know that we can take the vaccine like everybody else. But from what I understand, they're still waiting for data from all the other trials to come out and to make sure that it is safe for all of us. So, guys, the only thing that we have to do always, of course, is to be compliant with our doctor's orders and, of course, right now, the CDC, and practice safety guidelines, which is social distancing, washing our hands very, very often, and, of course, wearing a mask as soon as we go out the door. But for now, we're just waiting like many other people. And just so you know that you're, like I said, you're not alone in this journey. We're all waiting, guys, to try to see what's going on. And hopefully we will get some news very, very soon. Until then, I send you so much love. Just to let you know, as I said, you're not alone in this journey. And you are thought of every day. So, guys, take care of yourselves until the next video. Talk to you soon. Bye.